Finally, we discuss blood stasis in the stomach. This is always a chronic pattern that will have arisen from other stomach imbalances. As blood stasis is a pathological condition that always derives from other pathological conditions, it has no specific etiology. For example, we cannot say that such and such an emotion or diet leads to blood stasis. Blood stasis normally derives from the three main conditions of chi stagnation, cold, and heat. Etiological factors which cause these three pathological conditions are therefore indirectly causes of blood stasis. This is caused by long-term spleen and stomach diseases, cold pathogen congestion, or chi stagnation, all of which lead to blood stasis in the epigastrium. Key symptoms: epigastric stabbing pain, purple tongue, and choppy pulse. Clinical manifestations: epigastric stabbing pain, which is fixed in one place, pain aggravated by pressure and more severe after meals, poor appetite, emaciation, hematemesis, vomiting, which contains blood, hemophagia, which is blood in the stool, a dark purple tongue, and a choppy pulse. The newly acquired disease appears in the channel, and the chronic disease enters into the networks or collaterals. The etiology will depend on which patterns of imbalance are involved in the generation of blood stagnation. A stabbing pain in the epigastrium and a tongue that is purple in the center are enough to diagnose stasis of blood in the stomach. Blood stasis is a very important pathology because it potentially gives rise to serious diseases such as cancer, heart disease, and stroke. For example, one cannot get carcinoma of the stomach purely from stomach chi stagnation, but one can from blood stasis in the stomach. Stasis of blood often causes a pain of stabbing or boring nature, hence the stabbing epigastric pain. This pain is much more intense than in any of the other stomach patterns. Stasis of blood always manifests with dark-colored blood, hence the vomiting of dark blood. Since the stomach is related to the large intestine, the stasis of blood extends to it and is manifested with blood in the stools. The purple tongue reflects the stasis of blood. Please note that the tongue may not necessarily be purple. If a patient has clear manifestations of blood stasis, but the tongue is not purple, it simply means that the blood stasis is not severe. So for blood stasis in the stomach, etiology: overconsumption of hot foods, smoking, overeating or eating too quickly, emotional strain, prolonged anger, frustration, and resentment, and overwork. Underlying pathology: stomach fire, retention of food in the stomach, liver chi invading the stomach. Signs and symptoms: severe stabbing epigastric pain, which is worse at night and worse for pressure, nausea and vomiting, vomiting blood, blood in the stools. Pulse is wiry, tongue is purple. Treatment principle: clear stasis, nourish blood, stimulate descending of chi. Acupuncture treatment: stomach 34 to harmonize the stomach 19 to harmonize middle burner, spleen 4 to open the chongmai, GB 34 to force liver chi, bladder 17 to clear stasis and quicken blood, Ren 11 to harmonize middle burner, regulate chi, stomach 21 to transform stagnation, Sanjiao 6 to clear heat in the three burners, pericardium 6 with spleen 4 to open the chongmai, Ren 12 to harmonize the stomach, and spleen 10 to clear stasis and quicken blood. Needle with drainage. Relevant advice: this will depend on which imbalances underlie the blood stagnation in the stomach. Thank you for your attention.